Welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. And on this episode, I am talking with Beth Partain. And she is sharing her story as a survivor of postpartum depression, postpartum anxiety, and birth trauma. An emergency birth due to a random placental abruption. And she's also a NICU mama. So she's sharing parts of her story, how it was balancing parenting and starting a psychotherapy practice, and also bringing therapy to a rural area. There are many parts to her story that are important, and I'm so grateful she's here to share it. She's a licensed clinical social worker and mom to 3 beautiful children. She started her practice, Flourish Counseling and Consulting, in 2020 with the intention to empower women and bring specialized perinatal expertise to an area where it had never been available. She wanted to do this based on her own experience with the local hospital regarding birth and NICU trauma, her struggle with postpartum depression and anxiety following the birth of her first child, and to bring awareness to the local hospital that these conditions can really affect perinatal women. She's the first mental health provider in Owensboro and the Western Kentucky area to have a perinatal mental health certification, and is working on the new Maternal Health Council at her hospital. She's a Blue Dot ambassador and works in advocacy with Maternal Mental Health Leadership Alliance and has led 2 PSI claims in Owensboro. She's working really hard to get training to local healthcare workers in her area and other therapists to help identify perinatal mood and anxiety disorders from a trauma-informed care focus. I look forward to you hearing Beth's story. So let's dive in. Welcome, Beth. Thank you for being here.
Yeah, thank you so much for having me. I'm excited to be here.
I'm grateful that you're coming on to share your story. And in particular, I think it's also helpful for people to hear what it's like to be supporting people in rural communities. So we'll get to that a little bit later. But first, let's start with your story, wherever you'd like to start.
Okay, sure. So I have been a therapist, getting close to 10 years now. What really started my journey into the perinatal community was my experience with my first child when she was born in 2017, had a perfectly, completely healthy pregnancy. And then at 34 weeks, just had a very unexpected random placental abruption and ended up having an emergency C-section with her. So she was born 6 weeks early, and we spent 3 weeks in the NICU. And not only is that just a traumatic situation all the way around, right, but then add in what I felt like was almost zero support from a mental health standpoint, as far as like NICU staff, hospital staff, just very little concern for how our mom and dad doing. And that made it really rough. Yeah.
Yeah. I mean, so there's a lot in there. In terms of placental abruption, for people who don't know what that is, can you explain a little bit about what that is and what it was like for you?
Sure. Yeah. So placental abruption is essentially when your placenta detaches before baby is ready to be born. Oftentimes those can be missed. And so I am thankful that although I did not have hemorrhaging, oftentimes mom will have like outward hemorrhaging where she bleeds and you can see it. Mine was trapped, but at least I had quite a bit of pain, like pretty significant pain that alerted me that something was not quite right, which caused me to go to the hospital. And they had me in there for hours and hours telling me, oh, it's just gas. Like, you're okay. There's nothing wrong. And all of a sudden it wasn't okay anymore. And they were like, we have to take the baby now. We think you're abrupting. So yeah, it was a lot, but yeah, it's essentially when the placenta detaches before it's time. And it is an emergency because baby needs, everything from the placenta. So.
Right. Absolutely. So you were just kind of like going on about your day, and all of a sudden this happened.
Yeah. Yes. We were at home. It was maybe like 5:30 or so. Gotten home from work, had a totally normal day. I was just kind of laying. I mean, I was 34 weeks pregnant at this point. So I was tired. I'm just kind of relaxing on the couch. And I all of a sudden felt like this really sharp pain in my side. got up, tried to kind of like walk it off, thought maybe I pulled a muscle. That's really what it felt like at first. And then it got so intense that I was like, I can't stand this. And something was signaling to me, like in my brain, that mom gut, like, hey, something is not right.
Yeah.
You need to go get this checked out. And so ultimately that's what we did.
Okay. And then how long was that? You were saying they were kind of monitoring you and thinking it was just gas because what?
Yeah. Yeah. Wild. Let's see. It was, we were in there. She was born at 12:20. And so we were in there for at least, 5 hours, I think, before anything really started moving. The final straw was when my husband went out there and said, you have to do something for her. She can't even get back up in the bed right now. And that's when things really started moving.
Okay. Oh, good. I'm glad he
Yes.
was able to do that.
Yes.
I mean, he saw you
in
yeah, excruciating pain.
Yes. Yep.
Okay. So, right. At that point, then things just go very quickly, I assume.
Yes. Yep. Yeah. Prepped me. Luckily, I did not have to be, put to sleep for the C-section, but it was like boom, 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 super quick. They got me prepped, got us back there, got me the epidural, and she was born 20 minutes later. They told us at midnight and she was born at 12:20.
Oh, that was really very fast.
Very, very fast. Yes.
Also very fast for you to have to, I don't know what your brain is doing at that point with all of this, but that's a fast transition for anything, let alone going from being in pain to C-section.
Absolutely. Yeah. Yes.
So did it feel like a shock kind of a feeling, or?
I think more so I was more numb than anything.
Right.
I think that was my initial reaction. Just like I did not register what was happening at first. And I would say, even if, I know we'll get into this further, but as far as like perinatal mood and anxiety disorders, like I obviously had a lot of birth trauma from this. And just kind of like that, almost like the floaty, like watching yourself type of feeling. That's kind of what it was like. I think those first few days, especially.
Wow. Yeah. So was baby okay?
She had, of course, because she was only 34 weeks, she did have to be on oxygen for about 24 hours. She had a couple of episodes like where her oxygen would drop super low. And so she would desat, all the alarms would go off. And so that was scary. And then she was in the little incubator. They kept her in the little incubator she was in there probably for about a week and a half, I would say. Of course, I advocated for a lot of skin to skin, was met with some resistance to that, which I found very odd. Because they told us that it was overstimulating for her to be out of the incubator too much, but didn't really listen to that. Just kind of kept her on me whenever I could. So but yeah, other than that, we really had to wait for her to be able to take like full feedings to get to go home.
What about you? How long were you in the hospital?
I was discharged, I think, about 4 days postpartum.
Okay. So that process, pardon me, the process for you post C-section, were they just like monitoring you, or what was going on for you physically? And I guess maybe you were still kind of numb at that point, but
just monitoring, trying to keep me comfortable, because it was, C-sections are difficult anyways. And then, just the quickness of everything. I was pretty sore and everything for a couple of weeks. So,
sure. So after discharge, then did you live close to where the hospital was, where your daughter was in the NICU, or did you have to travel?
Yeah, we lived close. We did choose to, like, the hospital has hospitality suites where you can pay, I think it was like $20 a night to stay. And so we actually paid for one of those suites for, several nights. And there was not a night that we went home and slept the whole 3 weeks she was in the NICU. We stayed there. Of course, that was a luxury that we realized we had, because now having 2 other children, I don't know how we would make that work with two kids at home,
Oh, sure.
while one is in the hospital. But yes, when she was born, we were able to stay the entirety of her hospital
Oh,
stay with
that's
her.
pretty amazing. I don't think every hospital offers that.
No.
Okay.
It was
So,
really great to have that.
right. To be able to be close and see her whenever
Yes.
you wanted to or could.
Yes. Yep.
Okay. And then what was it like for you mentally, emotionally while she was in the NICU?
Yeah. Really rough. Like sometimes I think back on that, and I now that I know all that I do about perinatal mental health, I'm like, obviously something was not right
Mm-hmm.
with me or my husband, because we both struggled afterwards. And I think it's something like you might kind of know in the moment, but you're in survival mode.
Right.
Because we live away from our family, and they don't live very far, so they were able to come in a couple of times, but we didn't have a lot of support like right here in Owensboro with us. And so that's hard. And but yeah, looking back, I'm like, wow, something it was definitely not okay.
Right. So you
Yeah.
said there was nobody really checking in on you or either of you,
Hmm.
just to see how you're doing.
Yeah. Yeah. We had a couple of nurses that were very, very good. I mean, the ones that definitely stand out, not that all of them weren't good as far as like with our daughter.
Oh, sure. Right.
There were definitely ones that were maybe a little more hands off with us.
Mm.
Definitely no one mentioning mental health or, asking like, hey, could you talk to could you use a therapist to talk to? And again, I was a therapist at this point, but not trained in perinatal mental health.
Right. Right. So, what was your kind of mental health journey, if you will, through
Hmm.
all of this?
Yeah. Well, so in the NICU, again, it was almost like survival mode, because in a sense, like, you're pumping every 2 hours, like, but other than that, and holding her and feeding her, like, there's a lot of rest that can be done in that very early postpartum period. So it felt like time was just crawling by while we were in the NICU. And then, so some days it would just feel really defeating. I think just having a lot of time to, yes, I was enjoying skin to skin with her. I was enjoying having her here. At the same time, I wish it had been under different circumstances.
Oh, for sure.
There was a lot of time to think. I blamed myself a lot,
Oh,
even though doctors, reassured me like multiple times it was not anything that I had done. But yeah, that was hard to just sit in my own mind most of the day and, think like, oh, what could I have done differently?
oof. Yeah, that's a lot of pressure for
Hmm.
sure. To say the least. Did you do you? I mean, I guess looking back on it now, do
Hmm.
you remember any time where it registered for you that like, yeah, something's going on for me, like trauma or depression or anxiety or any like when did that sink in?
Yeah, I think I mean, I would say from about 3 months, maybe like 2 to 3 months, I knew like, okay, you have birth trauma. Like you are dealing with maybe some PTSD here. But it was much, much later that I admitted to myself, like, you have postpartum depression, because it didn't interrupt my bond with my daughter. I didn't have any kind of, difficulty maybe getting up and taking care of her. It was maybe more on the anxiety side for me. I definitely feel like I had both, but anxiety of like, you're not a good mom, you don't do things good enough, you started off this parenthood thing on a bad note, like, there's no way to recover from this, is kind of the overwhelming thoughts that I had going on in my mind. And that was something that I didn't really realize was not quite normal, maybe until about 6 months postpartum, and then didn't seek help for it because there was nobody around that specialized in it until at least, I mean, between 12 and 18 months. postpartum.
So was this just kind of like a white knuckling
Yes.
situation, holding on for dear life?
Yep. Yeah. And I think if you asked any of my family, I don't, and friends, I don't know that I really ever shared that with many people, that I was really struggling. Yeah. It was a lonely time.
Yeah, for sure. I mean,
Yeah.
so like your outward appearance, I guess,
Hmm.
like to other people, did it mostly remain the same, do you think?
I think so. Yes, I think it was very high functioning, because again, I like the term that you just used, like just kind of white knuckling it. I
Hmm.
was doing that for my daughter, like
Hmm.
just to get through.
Yeah.
And yeah.
Okay, and did your husband have any sense that something was going on for you, or was he, like you said, he was also struggling? Was he kind of in his own thing?
I think he did, but I think we have both learned so much over almost 8 years of being parents now,
Hmm.
that it's like we look back and we're like, wow, we really needed some support. And just being first time parents and thrown into all of the birth trauma, the NICU stay, it was, yeah, it's just something you look back on and you're like, wow, how did we make it through that?
Right. Yeah, you wouldn't have been able to imagine how you could have gone through it if somebody told you that's what was going to happen.
Sure. Yep.
So it like all through this, like 12 to 18 months is a long time to be suffering. Were you like back
Mhm.
to work and trying to do normal life?
Yeah, yes, I had returned to work maybe at like it was almost 18 weeks that I returned. And I mean pretty much since having my daughter I've been part-time. And so I was working for an agency at that point. I only returned a couple of days a week.
Right.
And yeah, the immense guilt feeling, just when I would have to drop her off, she was with like a private sitter up until she was a year old, and it was just the guilt was just ate at me
Mm-hmm.
every single time. But I knew I had to work to finish my license because I was so close, and
Mm-hmm.
supervision for the licensing
Oh gosh, that's
is
tough.
what kept me there.
Yeah, for sure. Okay, so all of this time's going by, you're
Mhm.
trying to just do life. How did you finally get help? Did you find somebody who could help you? How did that work out?
Yeah, I found a really great, it was actually a therapist that was recommended to me, like through my husband's employee assistance program. I finally called, and I will shamefully admit that the first therapist that I was supposed to see, I no showed because I was terrified. As a therapist, I'm like, oh, why did you do that? You hate it when people do that to you.
Mm-hmm.
But I was terrified. And I don't think I really wanted to admit that I was having a lot of anxiety, because again, you're a therapist and you're like, man, I should be able to fix this for myself, but
Mm-hmm.
you can't. It's not the same. Unfortunately, we can't therapize ourselves. So
Right. Right.
and so yeah, so the first one I did no show, but then I found a great therapist that was recommended, and I did it. I showed up to the appointment. She was not like trained in perinatal therapy or anything, but we ended up doing some EMDR, and she really helped me work through not only the birth trauma, but also a lot of that anxiety that I was trying to work past, those intrusive thoughts of you're a terrible mom, and
Mm-hmm.
and yeah, she was really great. So
That's
she was
awesome.
definitely very helpful. Yeah.
So how long then? I mean, the just even the starting of the therapy process, the beginning
Hmm.
is not when you feel exactly better. How long did
Right.
it take for you to kind of feel back to yourself a bit?
Ooh, I would say my daughter was well over 2 years old
Mm-hmm.
before. And I had started off marriage with my husband, like, oh, I want 5 kids. Like, I was in it. And I just, after her birth, I was like, I think I'm done. Like,
Oh,
I don't want another child. And yeah, it was something that we definitely thought long and hard about before jumping in. But that EMDR helped so much in getting some of that fear worked out for me.
that's amazing, right?
Yeah.
I mean, to going from like not being able to imagine feeling different, better,
Mhm.
and then finding the thing that works and helps you.
Yeah.
Again, like you can't imagine that you're going to be able to get through it.
Right.
That's
Absolutely.
pretty cool.
Yes. Yes. Yeah, I love EMDR.
Right, right. It's amazing.
Yes, it is.
So how did all of this like impact you on the bigger scale?
Uh-huh. Well, I mean, again, I think that, it really impacted how we chose to grow our family. We did not, I always kind of thought that we would maybe do like a couple of years in between children, that kind of thing. And it really took me a long time to kind of work up the courage to even try again for our second. And my daughter she turned 4 a month after our second was born. And so, yeah, it definitely impacted the way that we chose to grow our family. Obviously impacted my career, because in 2020, that's when I started. Once I was fully licensed, that's when I started my practice, right before COVID hit. And so that
That's
was a
rough.
fun little, yeah, fun little detour. But I did finally get things kind of up and running, maybe like halfway through 2020, and been going since, just really trying to get the word out to different OBGYN offices, hospital. And, I've definitely seen a lot of change in the maternal mental health field in Owensboro
Oh,
since 2020.
oh, that's great. So,
Yeah.
was did you find out if there were any other perinatal mental health trained providers around you, or were you kind of like, I know you got training and all of that stuff in perinatal
Uh-huh.
mental health along the way. Were you one of the first?
Yes, yes. So I took my training, let's see, probably it was in December of 2019. Actually, first time ever really being away from my daughter. Flew out to San Diego, and I was like, I'm doing this. I was determined to get the first training I could, in order to open up my practice. And I flew out for the PSI trainings, and they were amazing. And I know that was a large part of my personal healing as well, is just kind of getting some validation for how I was feeling and what had happened.
Right. Yeah, that's sort of amazing about going to those trainings after you've been through something like it, because
Yeah.
it's so much that you resonate with. Like, oh, that was me, or that's what I felt, or oh gosh,
Yes.
that's what that was.
Right. Yeah. There was a lot of those moments where it was like, oh, that's what that was. Like, I wish I had known, I wish I had this awareness,
Right.
when I was going through it.
Right. Would have could have potentially saved you time
Sure.
and stress and heartache and all of that. Okay, so then like bringing this awareness to your town,
Hmm.
this is a rural area.
Hmm.
There's not other providers. Well, at the time, anyways, doing perinatal mental health work.
Right.
What was that like to like be bringing information into the hospitals and to the doctors? What
Yeah.
was the reception to that?
Yeah. I mean, I would say, starting out, I started smaller with OBGYN offices. I had intention of kind of working my way into the hospital, because I knew that, I mean, they come into contact with every mom in the area and surrounding counties, because we are a hospital that serves, several surrounding counties. That's
Mm,
the only hospital,
mm,
I mean, within 45 minutes to an hour.
okay, yeah.
So yeah, it was daunting.
Hmm.
I felt like it was a lot of just like personal relationship building, a lot of marketing, like myself on paper, because it's hard to get into some of those OBGYN offices sometimes, because they serve so many different patients.
Right.
They're booked constantly.
Hmm.
Yeah, so it was a lot of marketing on paper, a lot of
Yeah.
social media marketing,
Hmm.
just trying my best to get the word out there.
Did were people providers in particular
Mhm.
like open to your specialty, open to hearing about perinatal mental health and referring people out?
Yeah, absolutely. My own midwife was elated when I came to
Hmm.
her with it, and I said, "Hey, this is what I want to do." And she was like, "As soon as you can take insurance, like, Medicaid were some of the first plans that I credentialed with for my practice. And she was like, as soon as you can take insurance, let me know. And she's honestly where a lot of my referrals came from one of the bigger practices in town, which has now been bought out by our hospital. But yeah, and so she was amazing. She was definitely receptive and like, oh my gosh, this is so needed. The other doctors that she worked with, they were also very receptive. I can't say that, I really ran into anybody that was resistant to it.
That's
Everybody
great.
was willing to learn, and I think had seen it in some capacity in
Sure.
their practice as a midwife or a doctor.
Well, that's fantastic because I mean, you
Mm-hmm.
don't if you're doing something new
Mm-hmm.
that people may not know a lot about.
Sure.
It's hard for people who are inundated to try and integrate something new into their practice or their
Yes.
workflow or whatever. For the fact that people were receptive is
Yeah.
amazing.
Yeah, absolutely. It was really refreshing to see, yeah, just how receptive a lot of the providers around were. And I mean, just random people just reaching out to me on Facebook, like on my business page, like, I am so happy to see you here. I wish that this had been around. And I was like, you know what? Same. That's why I did it, because I needed it.
Right.
Again, thankfully I found a wonderful therapist, but just knowing that a perinatal therapist even existed probably would have had me reach out sooner than what I did.
Right. And you said it's sort of grown, or awareness has grown at least.
Uh-huh.
Are there other people getting training in
Mm-hmm.
perinatal mental health around you?
Yes.
Yeah.
Yeah. Yeah. There's been at least a couple of other therapists around that have gotten the training, which is awesome because my referrals are just booming and it's only me. And so you know, it's just so needed. And I'm glad that there are other people that are getting the training and seeking certification to be able to work with these moms because it's needed.
That absolutely it is.
I really think another, big part. I mean, I know I'd mentioned taking like the PSI trainings and how that was really life changing for me. Not even on a practice level, just on a personal level. Being able to get some of that validation, be with other moms that were therapists seeking the training for professional reasons, but also were like, this was me. I struggled. And I think
Yeah.
really just being able to connect with people that understood, and yeah, they were trying to do their best at healing as well. Yeah, learning professionally, but also healing their trauma and their experience with PMADs.
Yeah, I mean that's I think really unique about this specialty, and maybe it happens in other specialties too,
Mm-hmm.
but for perinatal mental health, there are a lot of people who get the training who've been through it and are getting training because they've been through it,
Sure.
or somebody that they care about has been through it. It's definitely there are people who just have a special interest in it and want to help moms too,
Uh-huh.
but that kind of community of both having been through it and being able to help other people is really really it it's for lack of a better word pervasive. Like a lot of us
Yes.
have been through it as well, and you just like as I said before, there's maybe other specialties who have that, but like if you're just going to maybe an OCD training,
Mm-hmm.
it's possible that other therapists are dealing with OCD too, but I don't know at what rate, Anyways, it creates
Right.
quite a community.
Yes, absolutely. Absolutely. And another really just, I think, monumental time for me personally and professionally. I've led 2 climbs now for Postpartum Support International, and just again, just the moms coming up to me saying like, I'm so glad that someone is paying attention to this. Like, I'm so glad that there's this space for this. That means a lot because again, and yeah, when I was back in that in 2017, 2018, like it was not something that that was well known, at least in our area.
Right.
And so, yeah, just knowing that there's that support for moms and there's that community for moms that really need it, that means a lot.
For sure. And that is something that the climb really helps with. And you having that gathering of people who also know in their own way, know what it's like
Yes.
to go through whatever their version of perinatal mental health condition is, and
Yeah.
come together and to it's I think it's so much harder to build community these days than it was in the past, meaning like actual people coming together face to face.
Right. Right.
Especially after COVID, that made things even more strained.
Yes.
But that face to face, like human interaction in person, is really powerful.
Yeah. Yeah. And I'll be honest, like a couple, I developed a training, and I don't have it. I've presented at a couple of different like CEU events. And so it's been credentialed. I don't know if that's the word that I want to use, but it's been credentialed through other trainings, as they would get CEUs for attending the entire training type of deal. I don't have it credentialed on its own, but I've presented several times, and each time I do, like the amount of people that sit in the room and again are just like, oh my gosh, that's what happened to me. Like that's what I was feeling. I so needed this when I was, having my children and, kind of journeying through postpartum. Like I needed someone to tell me that this is what was going on. And the training that I did is very trauma focused. And so it really focuses on a lot of those things that maybe some people wouldn't even consider traumatic. But sometimes just having a baby and being postpartum on its own is traumatic.
Right. Sure.
It's a huge life change. And so just again, bringing that awareness to not only other clinicians in town, different nurses at different hospitals that say, just kind of clicks for them. Like, oh my gosh, this is what I experienced, or I had this patient that experienced that. Now I know for the future what to look for. Yeah. It's a good feeling knowing that people have the awareness to look for it in their practice or in their hospital.
Yeah, absolutely. I mean, hopefully so many more people, it's getting caught earlier. They're not having to suffer as long.
Yeah.
And even for the people who are having that realization, like, oh my gosh, that was me. I think there's a lot of healing in that too.
Yeah.
Just to, even after the fact, no matter how long after the fact, to be able to recognize that it wasn't just you. You're not the failure. There's other people who experience the same thing.
Yeah.
It's so powerful.
Yeah, absolutely. Absolutely. And our community has made great strides in maternal mental health. And yeah, it's really good to see. Our hospital's doing the screeners now. So like every mom is getting the screener done, 24 hours after birth, 2 weeks after birth, 6 weeks. So yeah, it's really nice to see a lot of the change.
That's a big deal.
Yeah.
That's a huge deal. I mean, who would have known that all of this would come out of your experience?
Well, and I can't credit what the hospital's doing, to my to my practice or anything like that. But yeah, just again, just having that bug in people's ear, like knowing, hey, this is something we have to look out for.
Absolutely.
This community of people really needs to be taken care of.
Yeah, I think this is important for multiple reasons, but because it can feel like such a huge like problem to solve. And like, how do you, that urgency that I think you were feeling of like needing to make sure that you can help other moms and other families, that can be really overwhelming.
Yeah.
And feel like such a big, huge task. But to be able to hear like a story like yours, where remember there were not resources and it has grown to have resources. Maybe it takes a little bit of time, but it definitely can get there with, being persistent and consistent. And I think there are a lot of people in communities like yours was, and it is now, needs the resources and
Yeah.
are thinking like, how are we going to do this?
Right.
Um,
Right.
and it happens, just one step at a time, getting the word out.
Yes.
It doesn't have to be some like that $1 million campaign or something,
Right.
who has that?
Yes.
Like change can happen in ways that has ripple effects that impact a lot of
Absolutely.
people.
Absolutely. And I think that's something I have to remind myself of constantly
Mhm.
because I get caught up in my ADHD brain and I'm like, I got to do this and I got to do that. And I have this plan and I want to
Yeah.
do this thing. And this
I
is
have no
what's
idea
going
what you're talking
to,
about.
yeah, this is what's going to help people. Like I have this, idea, but at the end of the day, I'm one person and it takes time. And, our hospital does have another provider in town that took the training. She kind of had this idea to start like a maternal health council. And so our hospital has a maternal health council now, and being able to just all kind of come together and pool resources and ideas and just again that awareness that and just letting moms know, and not just moms but dads too. I do only work with women in my practice, but I'm really wanting to hire someone to work with dads because I know that that's a need that's out there as well.
Absolutely. Absolutely.
Yeah. And a really cool thing that did come from my trainings is a couple of male clinicians around saying, oh my gosh, like I'm going to start screening my dads for,
How cool.
postpartum depression.
Hmm.
And I've had a couple of people reach out and say, like, I've referred my husband to this person because they have this on their radar. And I think that's what's going on with my husband. Yeah,
That's
it's
super
cool.
cool. Oh my gosh,
Yeah.
that's great. It is hard to see like the longer view and how much things
Mhm.
have grown, but
Yeah.
wow. I mean, that's amazing progress.
Well, thank you.
Yeah.
It's really good to see.
Thank you so much for sharing your story and all that you've learned along the way and the work that you're doing now. I know, well, you know how powerful it is to hear somebody's story, but also to be able to hear how it's progressed for you through your community and the
Hmm.
work that you've done. I'm sure will support somebody to be able to do that in their community as well.
Yeah. Yeah. Well, thank you for having me and yeah, listening to my story. And I appreciate it. And I feel honored to be here. So
Thank you.
yeah.
If you'd like to get connected with Beth, please go to flourishcounselingobky.com. And you can also find her on Facebook at Flourish Counseling OBKY. There are so many important parts to Beth's story, and I'm sure that either you or somebody you know can resonate or identify with parts of this. If you think you know somebody who hasn't yet heard her story and would benefit from hearing it, please do share it with them. You can share directly from the app that you're listening on or from your computer. There's a share button in all of the podcast platforms. You can also find the share button on my YouTube channel. If you were able to watch this interview and appreciated being able to see our conversation, then definitely share from there as well. I'd be happy to have any and all of you as subscribers and followers, and anything that you can do to like or share this podcast helps keep us up in the algorithm to make sure that people can find this valuable resource. As usual, I thank you so much for being here. Until next time.